I think we owe it to the American people to begin to open this bill up and explain what's in it. I can almost guarantee you that there's not one member of the Senate who's read it yet. We're going to try to fit this in the Santa's sleigh this year so it'll be delivered to every American. I've got the first part here, 1,000 pages, small print, front and back. Started going through it, putting tabs in different pages so that we can talk about the different things, because sometimes they sound so extraordinary, people don't really believe they're in there. I'm not sure we'll ever get through the whole thing, but I just wanted to take a couple of parts tonight and just start talking about what is really in this bill. On page 17 in section 2713, it's titled Coverage of Preventive Health Services, which is really our jargon for rationing. It says a group health plan and a health insurance issuer offering group or individual health insurance coverage shall provide coverage for evidence-based items or services that have in effect an A or B rating in the current recommendations of the United States Preventative Services Task Force. Now, we heard from this task force a few weeks ago, but this may sound harmless enough as you look at it. But let's see what this really means. Evidence-based. A or B. What's not A or B? Well, just 2 weeks ago, we found out something that was not A or B. Mammograms are a C rating. And the task force came out and said that it should not be covered on anyone under 50 years old. Now, that's in the bill, that it would not cover mammograms for folks under 50 years old because it's not A or B. Because of the outcry, we had an amendment from the other side to give themselves a little bit of cover on that one medical procedure, mammograms. And we passed it with some fanfare yesterday, but the fact is there are going to be many C ratings that aren't covered. What are we going to do here in Congress over the next several years when we find constituents are not covered for things that they need in retirement from Medicare? Are we going to pass bills to try to cover those individual things? What we should really do is throw out the bill that's causing the problem. We should not be rationing care to our seniors. Let's look at another page. And I know this is not as interesting as talking about theoretical stuff, but on page 33, section 2719, called the appeals process, a group health plan and a health issuer offering group or individual health insurance coverage shall implement an effective appeals process to provide notice to enrollees in a culturally and linguistically appropriate manner. Now, what do we think that means? Well, in fact, in 2001, this term has been used before, and the Department of Health and Human Services spent $10 million to figure out what that phrase mean. And we still don't know. I mean, it says health services that are respectful of and responsive to cultural and linguistic needs. But what this really means to us in the 2000 census, that there are at least 20 languages spoken by at least 200,000 Americans in this country. And what we're putting out there is a liability for every insurance company who doesn't have every aspect of their plan in those 20 languages. It may sound like a simple thing, but every page of this bill almost, as you read it, you realize it's increasing complexity and cost of the system here in America. I'll just cover one more of these, as I hear my colleagues urging me to finish here in the background. But I do think we owe it to the American people to begin to talk about what's really in this bill. On page 39, it says, under a funding category, out of all funds in the Treasury not otherwise appropriated, there are appropriated to the Secretary $250 million to be available for expenditures for grants under paragraph 1 and subparagraph 1. And what those subparagraphs are to track the trends in premium increases of health insurance once this bill goes into effect. $250 million to do what the Congressional Budget Office has already told us is going to be increases. But this kind of spending and this type of bureaucracy and complexity that we're creating is not going to make health care more accessible and more affordable for Americans. It is creating a complex bureaucracy with tens of thousands of workers and bureaucrats to tell us what to do, tell doctors what to do and hospitals what to do, and for us how to manage our health care. The Congressional Budget Office has already released a report finding that the purchasing health insurance exchanges that are in this bill could pay up to 16% more for health care than we do today. Yet we're moving ahead with this bill. I'll continue throughout this weekend and every time I get a chance to speak to talk about more of these things that are in this bill. But folks, this is not a bill we should deliver to the American people for Christmas this year. This is a bill that we should throw out so that we can start over and have a step-by-step approach to make health insurance more affordable and available to every American. With that, Mr. President, I yield back.